So I'm Dr. Sabaisen. I'm a medical oncologist and the Director of Medical Oncology at the Townsville Cancer Center of the Townsville Hospital, and also a clinical dean of the Townsville Clinical School of the James Cook University School of Medicine. And I look after all the rural and remote patients in our Townsville and Mount Isa Health Service districts, along with my 3 other medical oncology colleagues in this center. In our tele-oncology network, we have telemedicine facilities in all the small towns. So if it is about consultations, they don't need to leave their hometowns. That includes Mornington Island and all the remote indigenous towns. But if they need chemotherapy, obviously they have to travel to Townsville or Mount Isa. But if it is oral chemotherapy, a lot of the time they don't even need to travel to Mount Isa or Townsville, because we see them and then we send them the scripts and then we follow them up, and all managed on video link.
So Sabe, we're going to treat Steve as an outpatient. Are you happy with that?
Yeah, I'm happy with that. And
My name's Sonia Bisson. I'm the Cancer Care Coordinator / Clinical Nurse Consultant for Oncology at Mount Isa Base Hospital and District. Telehealth has been very significant in increasing our services in remote areas, because we can have a consult with the doctor and other treating specialists on screen, and they can advise us what to do if there's any changes in treatment, any new treatments, right there, just like they're in the room, and we can then go and deliver that care after the video conference.
My wife Helen, I'm Steve. We've been in Mount Isa 20 years next year, moved up here from Warwick. I got a job at the mine, and I've been underground for 15 years. And recently I've been diagnosed with cancer. I've got SCC, squamous cell carcinoma, which gets into your lymph glands. So basically it's an untreated skin cancer. It's got into my system, and now it's very difficult to treat. And as part of the continual care from the Oncology Townsville is the video link, the tele links we have on a regular basis. And that saves us a lot of travel, because it only takes me within 2 hours of work. I could duck off from work, have the consultation via the telelink, and be back at work all within 2 hours. To do the same consultation otherwise would be plane flights, accommodation and travel in Townsville. That takes 2 days.
The telelinking after all of the treatment and all of that has been just enormous. It's been excellent.
My name's Michelle Toombs. I'm Senior Medical Secretary, Admin Support Officer. I look after the medical oncology consultants. We do telehealth on a regular basis every week. Our role is to ensure that patients receive this care. It saves them travelling in and out, and particularly with the patients we deal with, they have to take into consideration they're not in the best of health, and we're trying to make it easier for them with their health care.
Once patients have their first session, they're usually very relaxed and easygoing about the whole procedure. Sometimes there's a little bit of apprehension at first, because they really don't know what to expect, but it's quickly gone once they see that it's all very, just like being in the room with the doctor.
You just walk in, you sit down, and the staff are just so wonderful. They're so friendly and helpful, and you just sit there and you wait, and then you go in and sit on your lounge, and then you wait for Sabe to appear on the TV, and he pops up there, and then you just start talking. It's just so natural. It's really easy going, and then when it's all finished, you've sort of got dates set for whatever's going to happen next. And yeah, I find it really
It's very relaxed, isn't it?
Easy going.
it's the same as face-to-face. The only different thing is there's a screen involved. So in the providing end, that is in my end, it could be me, it could be my registrars, and then at the remote end, we will have the patient, the family members, and sometime it's extended family members up to 10, 12, especially from indigenous communities.
My name's Sean Solomon. I'm been caring for my mother, who's been diagnosed with cancer for the last, I've been caring for her for the last 6 years. The big benefit of the telehealth has been really decreasing the stress that comes with caring for a family member, in terms of living in a rural town for one, and having to go back and forth to a regional hospital for therapy.
So it's very, very beneficial to reassure the patient that they can probably stay here for their treatment, have their consult over video, reassure them that their family members can attend the video conference with them, they can attend the treatment sessions with them, they don't have to be taken away from family and loved ones.
So we've established a really good relationship with the local clinical team and as well as the Townsville team as well.
Hello, my name's Michael Lambro. I'm a locum doctor here in Mount Isa Base Hospital. And because Mount Isa is 900 odd kilometres away from Townsville, it's often very difficult for the patients to actually make the trip for face-to-face consultations. And so telemedicine or telehealth, it's had a great uptake, and it's a really valuable service, I think, that the team in Townsville provide the residents here in Mount Isa and surrounding areas.
Right?
My name's Lyndon Roberts. I'm a rheumatologist who works in Townsville Hospital. I also work in Mount Isa and Palm Island. The work we do is mostly for people who have disorders of the immune system, and particularly ones that affect joints. The commonest is rheumatoid arthritis, which is a disease that affects usually younger adults and affects their joints. One of our patients is April, and she's been someone who would have been travelling over to Townsville, taking a day to get there and a day to get back on a 1 to 2 monthly basis prior to the service to Mount Isa. And then with telehealth, we're able to see her at the same interval. She just takes an hour off work, comes in and sees us, and then goes back to work.
I find I can just come to the hospital and have the interview with the doctor here, and it's so much better than travelling all the time. Dr. Umar checks all my joints, and the specialist can see on the TV how they are.
But I think for the moment you're doing very well.
Yes.
And that the fact that your joints are very, very good today, that's really encouraging. Yeah. And the bloods are good as well. So that's all excellent.
Yeah.
Dr. Lakshman sits at the end with the patient in Mount Isa. Now, she's able to examine the joints very reliably for the most part. And so we can do exactly what would happen if the patient was in front of me and I was examining with Dr. Lakshman at the other end.
The future for telehealth is great, and if we do it in properly, we can achieve a great success. And then we also look at a great cost cutting here, because we don't have to fly our patients to the tertiary center. There is no escort is needed. We are looking at greater cost cutting here, which can be diverted to others, other need for the medical services. That's how I'll be looking at telehealth at the moment.
I would recommend other patients to give it a go. As I say, it's up to the individual, but I find myself that it works for me and I enjoy it instead of having to travel. I find it a lot better to just stay in Mount Isa, where you can come to the hospital, have your conference over the television and home again.
I know she's found it a terrific service. I don't think she's had any problems with it, and I think she's a fairly typical sort of person in our service.
I think it's important to sit in on the consultation. It's an important learning experience, I think, from our perspective, to hear what our specialist colleagues have to say about the diseases that the patients are presenting with. But yeah, we're here to really support the patient through the process. And as I said, predominantly my work here involves oncology, so often there's a big emotional component, a lot of information being conveyed to the patient from the specialist that they may not necessarily take in.
After speaking with the docs locally, we'll have conversations about local arrangements and the local team supporting access to medication or other palliative care arrangements that are out there, like home care servicing, wheelchair access, all those sort of stuff. So that's been really great, the support of the local team, both the nurse and the doc and the reception.
I always go to the telelinks with Steve, because I just like to be kept up in the loop with all the information. And that's a good thing about it too, is that they're happy to have other family members there during the telelink. It doesn't just have to be Steve by himself. I'm always welcome to be there, and if my daughter wanted to come along, she could, she'd be welcome to come along as well. Yeah, it's very family orientated.
We also use these facilities, the telehealth facilities, for family conferencing. So we will get families, say, who live here in Mount Isa to conference with family members from, one of the outlying towns like Doomadgee or Normanton to, so that they can see each other and talk about, what's happening with their health. So it's not just purely a medical tool, it's also a kind of a social tool in that regard.
If you've got family spread out across the state or the country or in different towns, it's a way to bring everybody together and to support the carer role that you might take up as a family member.
Future of telehealth is really about coming up with more and more activities for rural patients performed through telehealth. So it's going to be all increased.
And we use it for many things in Mount Isa. And I'm really impressed at the level of professionalism and the level of follow-up and the level of care that can be given through telehealth.
We've been collecting information from all the patients that we see, and the findings in essence have shown us that patients are very pleased with telehealth, that we've been able to deliver equivalent rheumatological care with telehealth or without, and based on those findings, we're very happy to continue to support telehealth, and we're going to expand the services there.
So my advice to people who are starting telehealth is that start slow and make it part of your day-to-day practice. If it is just occasional patients, no big deal. You just dial out during your clinics. But if it becomes big, then obviously you need to separate it. So having MBS item numbers have contributed in a way that now we make money out of the telehealth consultations with a view to further enhancing our models. So the revenue we make out of the MBS item numbers, now we can actually put it into buying extra machines or employing administrative support officers to make the system even more slick.
The main driving force behind telehealth is we are concerned about the patients, and we're trying to make their cancer journeys as easy as we possibly can.
Telehealth is helpful to, particularly in Aboriginal families or Indigenous families in Australia, in that it does support family decision making. So I would strongly encourage that any Aboriginal family or carer or patient to don't be frightened of the technology, I think, and what it's about, because it really offers huge benefits to Aboriginal families, I think, and it supports the way that we do things as carers in the health system.
And I would firmly believe the future for telehealth is great, and if we do it in properly, we can achieve a great success.
I have no reservations using the Telelink system, because the information, he's right there face to face. It's not like you're on a telephone. You can see him thinking and talking, and it's a good way to go, I think.
It's the way of the future, and it's the way we should be doing it for remote areas, because of the logistical problems of ongoing illness.
Yeah, I would really encourage other clinicians to give it a try.
Use it. Yeah.